Welcome to the Ghanaian Doctor. Like, share, and subscribe. Thank you.
Hello, lovely viewers. Today we are here to discuss finger clubbing. Finger clubbing was first identified in 460 BC by Hippocrates. It was identified in a person who had lung abscess. Along the line, many conditions have been identified which can cause finger clubbing, and they include several lung diseases from lung cancer to lung abscesses to severe lung infections like bronchiectasis and other lung diseases. Heart diseases, especially children born with heart conditions. Also, certain other heart conditions can also lead to finger clubbing. Liver diseases, cancers, stomach cancers, lung cancers, and a lot of other conditions can all contribute to finger clubbing. In 5 to 10% of cases, there is no identifiable cause of finger clubbing. However, because of the overwhelming numbers of situations where there is an underlying cause, all finger clubbing cases should be investigated so that the cause can be treated. When identified and the cause is treated early, finger clubbing can reverse. But in most situations, because identified early, it gets to a stage where it is irreversible. Let's talk about some details of what actually goes on in the fingers. Usually, finger clubbing comes about when there is reduced oxygen levels in the fingernails. When there is reduced oxygen levels in the blood flowing to the fingernails, it is associated with the production of certain factors that cause fluid and collagen to be laid down in the tissues of the fingernails. Over time, these fluids and collagen harden and fill the spaces in the fingers, causing the typical rounded shape that the fingers take up. Finger clubbing can happen in one finger, in one hand, in both hands, in the toes. What should you do if you identify that yourself or a friend of yours is developing finger clubbing? We have to immediately go to the hospital. They can do an x-ray of the fingers where we look at any changes in the bone. You don't need any investigation to confirm that there is finger clubbing. The most important thing the doctors will do will be to try to identify what particular medical condition is causing finger clubbing in yourself or in your friend. After this is identified, the condition will be promptly treated and hopefully the finger clubbing will resolve. Finger clubbing by itself does not cause any medical complications, even though there are few cases where the increased fluid buildup can cause certain bone changes. But most of the time, it doesn't cause any medical complications. This is the little I have on finger clubbing. I hope you learned something. Kindly put in the comments if you have any particular questions on finger clubbing or if you want me to explain anything further. Thank you and take care.